ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. Good afternoon, everyone. On behalf of MCure Pharma, I would like to invite you all, and also on behalf of FPAI Bangalore branch, BSOG, KSOGA and BBMP. We are on webinar on gender sensitization, reality of the third gender. So I would like to welcome all guests and chairpersons, and I would like to also invite event coordinator Dr. Sunita also. Sunita ma'am, please post your CV. Dr. Sunita Mahesh is the medical director and maternal fetal medicine at Milan, Bangalore. Also, her areas of interest includes managing high-risk pregnancies and conceptions through artificial reproductive techniques. And also, she was a EC member of BSOG in 2019 to 22. And she's completed her DGO from MS Ramaya Medical College and DNB, and has received her fellowship in fetal-maternal medicine from Rajiv Gandhi University of Health Sciences. Welcome you all delegates as well. Over to Sunita, Dr. Sunita.
Yeah, thank you. Thank you, Mr. Bhatt. Good afternoon, one and all. I, Dr. Sunita, would like to extend a warm welcome to one and all to this webinar on gender sensitization and awareness about LGBTQ, reality of the third gender. The motto being diversity in humanity and humanity in diversity. I would like to thank Dr. Padmini Prasad Madam for organizing this unique webinar on a very important topic on transgenders. To chair this session, I would like to welcome Dr. Nagaratnama Madam and Dr. Venkatramana Sir. We are very lucky to have our guests of honor, Dr. Kalpana Apte, Dr. Shubha Ramrao, Dr. M.G. Hiremat, and Dr. Nirmala Buggi. Also, we have with us Dr. Balasundar, who is the Chief Health Officer of BBMP, Public Health. He was earlier the anesthetist at Corporate Hospital. I would like to extend my warm welcome to Balasundar, sir. Sir, we would like you to start this session with few words. As you have an important meeting to attend, I would like you to address the gathering first, sir.
You can stop sharing.
Thank you, ma'am.
Yes.
Thank you, ma'am. I'm really honored, ma'am. I thank the organizers and all the eminent doctors here for giving me this opportunity to give the open remarks. As you all know, LGBTQ communities, like they are united by a common culture and social movements, and at present they are referred to as third gender. In this group of people, the healthcare disparities is always there. So, especially LGBTQ youth are at higher risk for substance abuse, for STDs like HIV, syphilis, and cancers also. So, they also have a tendency to have mental health issues like anxiety, depression, and suicidal tendencies. So they are actually very sad to say this. They are prone for bullying, isolation, and rejection from family. They receive poor quality of care due to social stigma, lack of healthcare providers awareness, and insensitivity towards unique needs of this community. So this webinar will help to enhance the awareness among all of us healthcare providers to know about the coexisting disparities, challenges, problems faced by these people, and to provide a more comprehensive and human medical care to this community. It is not only that it should create this webinar, should not only create awareness, it should make us think and act upon this problem. We should see to that this third gender is also given the proper care because they are also human beings. They also have emotions. So we need to first, from our side, medical side, if we start taking care of them and looking at them with a soft corner, they will also feel that they need not worry, and it will definitely boost their morale. So I hope this webinar will definitely help to improve the whatever the present situation to a better situation. So with these remarks, I thank the organizers and the Dr. Padmini Prasad, Dr. Sunita ma'am, and all others for having invited me for this. Thank you, ma'am.
Thank you, sir. Thank you very much, sir. We will now move on to the sessions. I would like to first introduce our chairpersons. Yes. So our next guest of honor is Dr. Kalpana Apte. She is the CEO of the Family Planning Association of India. She is one of the largest civil society organization working on sexual reproductive health rights in India. She is a well-known expert in the field of SRHR and family planning. Her work includes translating community-level voices in policy speak. She is a member of various national and international advisory committees, task forces, and expert groups such as the International Advisory Group, Non-Surgical Permanent Contraception, University of Portland, USA, and Sexual Harassment Redressal Committee, Maternal Death Review Committee constituted by the Government of Maharashtra. She has several publications to her credit and has contributed many chapters for textbooks. Madam, we would like to hear from you.
Thank you so much for inviting me here. It's an honor and a pleasure to be here. Dr. Padmini, Dr. Sunita, and all the dignitaries today on the panel. This is a very, very important and a timely discussion. As said earlier by the esteemed speaker before me, the gender concept is constantly evolving and changing. And that also means that these concepts of being a male or a female or none or both, it is no longer decided by the society, but by the person themselves. It is the person who now gets to decide what they want to be. And if they are born in a body which is not of the gender that they want to be, then the journey from being born in a body which is not to their liking or to their identity to be what they want to be is a long and a hard journey, which actually makes them very vulnerable for multiple issues. And in society, in the communities, in the medical fraternity, and across, it's not a very clearly understood issue. And therefore, when people want to change the gender that they were born with, the sexual organs and the reproductive systems, then they face a lot of vulnerability. Many times they are asked to leave the home, they are on the road, and it is really very difficult. We all know women face a lot of negativity, as being a woman is very difficult. And in countries where patriarchy is very high and unequal male-female relationships exist, in those circumstances where people don't even have a clear gender identity or they are struggling, they are even more vulnerable than women also. They face more violence, they face much more ostracization, and very few facilities exist for them. So I'm really very, very appreciative of the fact, and congratulations to you, Padmini ma'am, for leading this discussion, which is very timely. And thank you for having me here. I'm very keen to learn from today's discussions. Thank you so much.
Thank you, madam. Dr. Shubha Ramarao, madam. She's a senior consultant, HOD at St. Martha's Hospital. She is the president, BSOG. She was the previous past secretary, joint secretary and treasurer, BMS. Previously, she was also the chairperson for Free Paper and Poster Committee, AICOG. She is a DNV teacher, a compassionate guide and examiner. Madam, we would like you to speak a few words to start this session.
Yeah, thanks. And KSOGA chairperson of the sexual committee, and she also has been my advisory. And I'm very pleased, to be in this August company with Dr. Kalpana, Dr. Hiremat, and of course, Dr. Nirmala, who is the CHO BBMP, and also chairpersons, Dr. Nagaratnamma and Dr. Venkat Ramji. And to this very interesting webinar conceived by, Dr. Padmini Prasad, who has been having unusual, even in her theme here, she had, some unusual topics to deal with. So we all know, I mean, a lot has already been said, and we all know that gender and sex are two different concepts with different meanings. Sex is biologically determined and it is unchangeable unless with intense surgical intervention, that is if that person desires to be, or there is some developmental problem. And gender is a social construct which is learned, it is dynamic, it is changeable, and it differs between and within cultures. There is gender, of course, there is gender stereotyping also, which is harmful, and gender inequalities are learned through education at various levels, including the family, school, religious, and society, and the wider community level. Now, many social pressures make one to conform to dominant gender roles. The third gender is a concept in which individuals are categorized by either by themselves or by the society as neither man or woman. See, the third gender or the LGBTQ is what we know them as. And it is a social category present in societies that recognize third or the three or more genders. Now, traditionally, we have recognized them as hijras, in the ancient times, and they have been, even Kama Sutra mentions these people since ancient times. And we all know that the problem is chromosomal or it is hormonal, and it is not something which is in their hands, because it is what they feel, and they don't feel the sex that they are born in. They don't feel the gender that they are born with. So they are, marginalized. And in 2014, especially in India, they are very much marginalized. And the Supreme Court judgment in 2014 guarantees inclusion in education and employment to these people. Now, it is important to be sensitive to them. As doctor said, they have so many problems, health issues and whatnot, and of course societal needs also. So it is very important to sensitize, to be sensitive to them and to cater to their needs and make them inclusive in the society. Now, Dr. Padmini, of course, will talk on gender sensitization. And as president of BSOG, I'm very happy to be associated with Dr. Padmini, FPAI, and BBMP. And we will be, hosting a mega camp for these marginalized LGBTQ community on 5th July at the Wilson Garden Maternity Home. And it is a camp of one of its kind. We're very much conceived by Dr. Padmini Prasad, and I'm very thankful. And I urge doctors who are, willing to come and sensitize themselves towards the needs of this special community. Thank you very much, Dr. Padmini.
Thank you. Thank you very much, madam. To start the session on the important topic on transgender by Dr. Padmini Prasad, we have Dr. Nagaratnama madam, who is actually the the past HOD and the professor at Radharadeshwari Medical College, Bangalore. She is the chairperson of Female Breast Committee of KSOGA. She was the president of BSOG 2019-20, executive committee of KSA, AGOI, and Bangalore Menopause Society. She was the registration committee chairperson of AICOG 2019, convener of Eurogyne workshop of AICOG 2019. She has successfully conducted Eurogyne live workshops at Radharadeshwari Medical College. She has conducted several CMEs, workshops, and conferences. She has several publications and has written chapters for Foxy Focus and BSOG Focus. She is part of the RGHS ongoing clinical trial. She has several appreciation awards to her credit, and her special areas of interest include urogynecological surgeries, high-risk pregnancy, infertility, and gynecology. Over to you, madam. The other chairperson is Dr. Venkatramana, who is the retired professor and HOD of OMC Hyderabad and Professor DVL GSL Medical College. He is the WHO fellow from 1990 to 2009, president of Indian Andropause Society, chairman, Council of Sex Education Parenthood International, India representative, Asia Oceania Federation of Sexology, president-elect, IAS, STD and AIDS, past President TSI ADVL, member Academic Committee Telangana State Medical Council, senior consultant sexologist, dermatologist and HIV and AIDS specialist. He also is a Golden Lamp awardee, which is the highest honor in the field of Indian sexology. He has also received the Best Sexologist Award 2005 in 2005 by Virodhi Foundation, working for bringing awareness in STD, HIV and sex education. Dr. Nagaratnama Madam, I would like you to introduce our speaker, Dr. Padmini Prasad Madam.
Yeah, thank you, Sunita, for that kind words. So it's my honor to introduce Dr. Padmini Prasad, who is the main speaker of today's CME. As we all know, transgender is a broad term that can be used to describe people whose gender identity is different from the gender they were thought to be when they were born. Trans is often used as a shorthand for transgender. To treat a transgender person with respect, you treat them according to their gender identity, not their sex at birth. So someone who lives as a woman today is called as a transgender woman and should be referred to as she and her. A transgender man lives as a man today and should be referred to as he and him. So understanding what it is like to be transgender can be hard, especially if you have never met a transgender person. So to throw light on this, the gender sensitization, the reality of the third gender, we have Dr. Padmini Prasad, who is a well-known and she's a first qualified woman sexologist from Karnataka. She is a medical director of Ramamani Nursing Home and Maternity Home, Bangalore, and she was a past president of BSOG. And also she has many awards from for BSOG, Best Society Award from KSOGA, Dhira Award from FOXI, and Best Society for Cancer Awareness from FOXI. She is also chairperson of Sexual Medicine and District Committee KSOGA, and also received Best Committee Award. Treasurer, South Asian Society for Sexual Health. She is member of World Association of Sexual Health, and also she is a chairperson of Family Planning Association of India, Bangalore branch, 2022 to 23, and she is a gold medalist in MD OBG, recipient of numerous awards and felicitations. To name a few are Rajyotsava, Kempegowda Rani Chennamma from Government of Karnataka, Bruhat Bengaluru Mahapalike Excellence Healthcare Award, and also Gold Lamp Award and Silver Lamp Award from CSEPI, Economic Times Inspiring Gynecologists of India, Times of India Emerging Icon Healthcare. And she has also authored 11 books on sexual and reproductive health in Kannada and English. So regularly she featured on television and radio on sexual and reproductive health awareness programs. She is a faculty in many national and international conferences of OBG and sexual medicine. She is the founder president of Baravase Charitable Foundation, Reach the Unreached and Speak the Unspoken. Under this, she has conducted a lot of mega camps and she is really serving the people. So over to you, Padmini, for your talk on gender sensitization, reality of the third gender. And also, I would like to thank the organizer for giving me an opportunity to chair this session, especially Dr. Padmini.
Ellarigu namaskara. Thank you very much for all the chairpersons, for MCure people, Dr. Sunita, and thank you chairpersons, and thank you Dr. Nagaratnama for that exhaustive introduction. Today, of course, with all the encouragement and all the cooperation from all the people concerned and all the organizations concerned, we were able to organize this CME, and which is very much important to create an awareness and to know what it is and what they should know when you are providing, when you are a healthcare provider to the lesser known people for the healthcare providers. And that is because we have also organized a mega health camp for this LGBTQ community on 5th July. So it is important for all the doctors who participate in that mega health camp to know about them and what are their problems, and what is the terminology or the different terminology that is used, what does it mean, what are their problems, and why are they treated like that? Is it because they wished it like that, or whether it is a voluntary thing or an involuntary thing? It is not about their problem. So all these things, there are plenty of questions that is usually we have, every person will have in that. So everyone is familiar about the persons clapping and begging at the traffic signals, railway station, etc. But people look at them with all the phobia, curiosity, disgust, hatred, and so many feelings. But we also give so much of rights to the even to the animals. But why are these? They are also human beings like us. Why are they treated like that? Why they should face so much of criticism or so much of problems in the society? So they are irrespective of age, gender, ethnicity, and whether married or not, and sexual orientation and gender identity all over the world. So there are sexual and reproductive rights. So they have every right on their body. They have got every right for their healthcare provision. So we should know what it is, and we have to be inclusive. We should have an inclusive attitude, and we should know how to address them, how to take whether we are taking any history, whether treating with them or understanding their problem. So to enlighten on that, so I'm going to talk on this topic. So many things, the clarity will be there. And if you have any questions at the end, you can even ask questions and clarify things. So now I will share screen. So I profusely thank BBMP, Family Planning Association of India, Bangalore Society of Obstetrics and Gynecology, Karnataka State Association of OB-GYN Societies. So gender sensitization. What is the reality of the third gender? That it is a diversity in humanity and humanity in diversity. We see diversity in the nature, and let us see what it is when it comes to human beings. So I will touch upon this topic on an introduction, what it is, about the terminology, healthcare etiquettes that we have to follow, transition phase, psychiatric assessment, medical therapy or the hormones, cross-hormone therapy, surgical options, healthcare, cancer screening, fertility options, contraception, pregnancy, chest feeding instead of breastfeeding, infections. So these are all the varieties of things for which we have to understand. Transgender medicine is an important aspect of healthcare. The transgender population forms a significant minority in South Asian countries, including Pakistan, Nepal, India, and Bangladesh. Known as Khwaja, Sira, Hijra, various terms in different places, they are officially recognized as a third gender. The legal acceptance that they have does not necessarily translate into acceptance within the healthcare system. As responsible healthcare professionals, we must ensure that transgender persons receive the same quality of primary and preventive healthcare that others do. With a recorded history of over 4,000 years and being mentioned in ancient texts, Hijra community is a testament to the sexual diversity that is integral yet often forgotten in Indian culture. Sanskrit is one of the oldest languages in the world and is known to use three genders: masculine, feminine, and gender neutral. The concept of Tritriya Prakriti or Napumsaka had been an integral part of the Hindu mythology, folklore, epic, and early Vedic and Puranic literatures. Transgender in Puranas, the first reference of transgender is the female avatar of Vishnu or Mohini. The Mahabharata describes the first appearance of Mohini when the Devas and Asuras had churned the ocean. And there is the procreation of Shiva and Vishnu, resulting in the creation of Ayyappa. that is Harihara Putra. So this is Shankara Narayana or Harihara and Harihara Putra. These are all there in our Puranas, mythology and folklore. Transgender in Ramayana. In the Ramayana, Lord Rama requested all the men and women to return back to the city of Ayodhya when he was going to forest. But when he came back, he saw a group of people still waiting there. They had not returned back to their place. The transgendered individuals stayed back. When Lord Rama returned, Lord Rama was greatly moved by their love and loyalty and sanctioned them the power to confer blessing on auspicious occasions. So that is why you only said men and women, you did not talk about us. So that is how even today in North India, there are so many auspicious occasions. There is they take blessing from hijras with the dancing and blessings. So this is the another one, Aravanan or progenitor in Mahabharata. Aravanan in Tamil literally the son of a snake. That is the son of Arjuna and Ulupi. And she was killed for goddess Kali to ensure the victory of Pandavas in Kurukshetra war. He has to spend the last night of his life as a married man. So Lord Krishna took the form of beautiful woman called Mohini and married him, because no one would marry him because his life is so short that he is going to be killed. This is the reason why the Hijras of Tamil Nadu call themselves Aravanis, named after Aravan, their progenitor. So there is a big festival in Tamil Nadu, 18-day festival, where almost all the Hijras and the transgender participate in that festival. This is another thing in Hindu mythology, the gender swapping from female to male and again male to female, which was there, that has been described. Shikandi, everyone knows about Shikandi. She was born as Shikandini. She changed her sex to become Shikandi. In the battle of Kurukshetra, Shikandini was the cause for Bhishma's death. You all know about it. So this is the concept of Ardhanarishwar, Lakshmi Narayan, all this androgynous concept has come from this concept. And there are various, there are famous transgenders. There are very, very talented people, exceptionally good people, whether it is in the literature or in the field of, in all the fields, we can say there are so many people. There is one Indian trans woman doctor who studied in Karnataka in KMC Manipal only. And there is a transgender police officer in Kerala. And there are actors. There are various social service, legal people, and there is a transgender university in UP also. So there are various models and famous people, dancers, they all are there, and very talented people who have been contributing to our society. This is the dancing and then giving blessing to people by this Hijra community. And this is the famous view, or everyone will have experienced these people, because that is the only thing they could have, because they were not taken for in any other field to earn their money. So the only thing that was left for them is for begging and prostitution. That is how they were leading their life. Of course, of late, they are gaining importance, and their legal and the political sanction they are getting, and trying to get them involved in various occupations. So this is also another famous movie. So many must have seen this. Nanu Avanalla, Avalu, where Sanchari Vijay acted in this. This is a real story of Vidya. She was a transgender, how she was converted into transgender, based on the life of Living Smile Vidya, a transgender woman who becomes an actor and activist. Unfortunately, we lost Sanchari Vijay in an accident. So this is today's paper. If many of you must have read in today's paper, The Times of India, Bengal ex-CM's daughter opts for sex change surgery. I have to live the way I want to. That is her conviction. That is Suchetana Bhattacharjee. She wants to change to Suchetan, a trans, from a woman to the man, trans man. In spite of the rich and varied heritage of transsexual individuals in the form of divinity and heroes from Hindu mythology, these individuals are still subjected to various forms of ostracism. It is only in recent times that they have been given the necessary social security and an ability to integrate into the community. Furthermore, these individuals are subject to stigma and biases that make them prone to both medical and mental health issues. These include substance abuse and also some legal problems. An integration of this marginalized community is of essence. Transgender persons must be treated with the respect and empathy that every human being expects and deserves. Healthcare professionals should speak respectfully using their preferred pronoun, what they use, whether feminine or masculine. Polite, non-vulgar, and non-threatening language must be used. They should get the feeling of support from healthcare providers and assurance of confidentiality. They need multidisciplinary approach like medical, metabolic, surgical care, dermatologic, cosmetic care, psychologic, psychiatric care, reproductive and sexual care, and also endocrine care. Transgenders have poor access to healthcare, no insurance, poor monetary conditions, clinicians' insensitivity, fear of exposure and discrimination. And this topic, the more than anything, the LGBT topics are not discussed even in medical curriculum. Obstetricians and gynecologists have to be aware, comfortable, knowledgeable, be familiar with recommendations for the healthcare and screening of transgenders, educational brochures for transgenders, proper referrals should be done. At least they should be able to refer them to psychiatrists, endocrinologists, surgeons, etc. And one can understand in this picture how the concepts of sex and gender and so much of wide variation has been there. If you take the self at the center or the core of a human being, there is sex, where it is chromosomal and anatomic, and there is sexual orientation, a gender the person is attracted to, gender identity, that is an internal sense of being male, female, or along the spectrum, whether you are born as male or female, whatever that you feel inside, whether as a male or female or a transgender. That is gender expression, how one manifests oneself through social norms of masculine, feminine, or variant. So this is the spectrum of things which are there in all these aspects. So when you come to this terminology and definitions, our guests of honor spoke so much about all this terminology and all that. So now you have understood what is this. Sex is a biological and physiological characteristics that define men and women. That is who you are. Gender identity, that is the inherent sense of being male, female, or transgender, regardless of biological sex. That is what you are. Sexual orientation, the sex that a person is physically, romantically attracted to, that is the sexual preference, either of same sex or of opposite sex. Gender non-conformity, the person's gender identity, role, or expression differs from the cultural norms prescribed for people of a particular sex as a male or female. So these transgenders are individuals who identify with the opposite sex rather than their natal sex or gender assignment at birth, and who have not achieved reassignment. Transsexuals, individuals who desire to achieve reassignment to their desired sex. Transvestism is a common terminology we use, but that is a paraphilia where there is a preference for cross-dressing, but there is no desire to change their biological sex. This is more for a sexual gratification that they change their dress, a man wearing the woman's dress and feeling happy and becoming sexually excited. Gender dysphoria is the discomfort or distress caused by a discrepancy between a person's gender identity and person's natal sex. So they can be transgender or transsexual. So we call it as transgender if they have this, when the transsexual is the one who has already undergone sex change operation. So this has been included in diagnostic and statistical manual and in DSM-4 and DSM-5. Earlier it was known as gender identity disorder. Now they prefer to use it as gender dysphoria. So gender fluidity is another thing where they feel their different gender identities at different times. There is also a small percentage without agender or asexual. So individuals identifying as having no gender identity. The cross-dresser or drag queen, drag king, you must have heard about these words. These terms generally refer to those who may wear the clothing of a gender that differs from the sex which they were assigned at birth. This is for mainly entertainment, self-expression, or sexual pleasure. The LGBT, this describes people's sexual orientation and gender identity. Lesbian, gay, bisexual, and transgender. So lesbian is a female who is romantically, sexually, and emotionally attracted to another female. Gay is the male who is romantically, sexually, and emotionally attracted to male. Bisexual, a person who is attracted to both sexes. So LGBT, how the word has started, in initialism started in 1990. It is an umbrella term for sexuality and gender identity. It has been replaced the term gay. Now they use more of this LGBT community rather than gay. Non-heterosexual or non-cisgender, LGBTQA, so many letters which are added up, intersex and queer, questioning, asexual, like that. So they in NIH and all, they prefer to use MSM, or men who have sex with men, or women who have sex with women, MSM and WSM. These are the trans men. How do we call it as trans men? They have converted to men. From female to male is trans men. From male to female is trans female or trans woman. The biological males who wish to live and be recognized as women is male to female, and biological females who wish to live and be recognized as men as FTM. Homophobia or transphobia, this is what I was talking about. We are scared about them. People are scared about them, what they will do for us, what they will do for our children, and they may do some other bad things in the society, and they may harm us. See, people are there who are bad people and good people are there, whether they are heterosexual or homosexual. But we have developed that phobia. The phobia, homophobia, or fear or prejudice and discrimination against LGBT, a dislike, hatred of these people, ignorance, prejudice, or stereotyping. Similarly, transphobia, a fear or prejudice and discrimination against transgender. There is increasing incidence of heinous crimes of sexual assaults against LGBT. Effective measures can be achieved and accomplished by changing the mindset of society at large. Gender sensitization is the modification of behaviors so that there is greater awareness and empathy to create gender equality. Gender and sex are two different concepts, as we understood now. Sex refers to biological differences between male and female. It includes genitalia, genetic differences, hence it is anatomical and physiological. There is another term, intersex, we use. Intersex is not same as LGBT. This is a reproductive or sexual anatomy which does not fit the typical definition of female or male. So gender, this how we understood how it is a social construct. It is a socio-cultural definition of a boy or a girl. People are born male or female. They learn to be boys or girls and grow into men and women. They are taught appropriate behavior, attitude, roles, and activities through so many of these values, dresses, opportunities, rights, and so the other things which define a boy or a girl. So that is a social construct. So sex is biologically determined and innate. Gender is a social construct, learned, and it is changeable. And gender roles, we commonly say a woman is meant for doing the housework and the routine domestic work and mothering. So gender roles are again a sets of behavior roles and responsibilities attributed to women and men that is thought appropriate for them. Again, they are learned and conditioned. Nowadays, it is all changing. Women are working in all places. Men are also participating in domestic work. Gender stereotypes. So male stereotype is masculinity, femininity, when you say. So male is a provider, protector, and procreator. And female, more of a motherhood, wifehood, nurture, be loving, caring, nurturing, and sympathetic. So they are all constructed from so many years through songs, media, religion, culture, custom, etc. So again, the patriarchy, that is again a social system where men and boys are considered superior and more powerful than women and girls. So men are seen as heads of households. And masculinity projected in various media, serials and the movies, manhood or manliness. A man should not cry. Man has to be like this. And there are various traits for them: strength, courage, independence, leadership, etc. So a real man, angry young man, these are all the words which have come from the movies. A physically strong and aggressive man. Oh, why are you looking like a girl? Why are you crying like a girl? So if a boy is little sensitive and emotional, so the boys are not allowed to even show their expression. So that is what it is. So there was a Transgender Protection Act in 2019, which prohibits discrimination against transgenders. Intersex one has to understand, because this is a term used for a person born with reproductive or sexual anatomy that does not seem to fit typical definition of male or female. So at the time of birth, when the gender assignment is done, if the external genitalia completely do not look either like a complete male or a female external genitalia, there is a confusion about gender assignment. There can be a large clitoris and lack of vagina. There can be a small penis or micropenis and scrotum divided. So developmentally, there has been some disturbance for the development of genitalia, where there is a confusion for this. Depending on whatever that looks like, then the gender is assigned for the child. But this shows up at the time of puberty, depends on what gonads they have inside the body. So there can be mosaicism in the cells having XX or XY chromosomes. External sexual anatomy does not always show up at birth until she reaches puberty. So there can be features of virilization, delayed puberty, or infertility. When you do the investigation, then you will come to know about that. So like different chromosomal abnormality. So sex development has two things: sex determination by XX or XY of the chromosomes, and there is sex differentiation, whether it grows towards the female sex line or towards the male sex line. So they call it as disorders of sexual development, depending on whether there is a chromosomal abnormality and insensitive to the testosterone produced or androgen insensitivity. So depending on that, so varieties of disorders of sexual development can happen. So one has to understand all this before doing. If there is an ambiguous genitalia, one has to keep a watch, do some more investigation, and then give a proper sex assignment for the child, and then do the necessary operations or the treatment that is necessary. And another word we call it as gonadal dysgenesis. This is nothing but congenital developmental disorder of the reproductive system, where the gonads, ovaries or testes, there is progressive loss of germ cells. That's why it will not produce the hormones properly, and that leads to hypoplastic and dysfunctional gonads. So like Turner syndrome and other thing which you are familiar with. So during embryogenesis, what happens? Initially, it is bisexual. It is not around 6 weeks of the intrauterine life. It is conditioned to give rise to female reproductive development. If there is no other influence within the fetal development, whether it is XX or XY, that fetus develops into female by default, unless we have important things that is happening inside the fetal development. Number one, SRY gene, that is the sex determining region in Y chromosome, and production of fetal testosterone, which helps in the growth of the male line, sex line, and anti-Mullerian hormone or the Mullerian inhibiting substance, which is produced in the body. If there is no Mullerian inhibitory factor and testosterone, that can lead to gonadal dysgenesis. So proper development into male or female line will not happen. So this is the absence of testosterone can be there during development, or absence of Mullerian inhibitory factor. So irrespective of XX or XY, if there is some autosomal or sex chromosomal problems, all the different things can happen. These are all developmental aspects. So this is entirely different from what we learn about LGBT or transgender, because that is they are born properly, they born with the normal sexual internal and external sex organs, and they all that while natal sex, whatever that is assigned, will be different from as they grow up. That differs from what they feel inside or what they feel like male, female, or transgender. So there is a World Professional Association for Transgender Health, and that says the expression of gender characteristics, including identities that are not stereotypically associated with one's assigned sex at birth, is a common and culturally diverse human phenomenon that should not be judged as inherently pathological or negative. So there are various barriers to healthcare. The transgender individuals face substantial barriers to accessing healthcare. That is because of the professionals' bias, lack of knowledge in the professionals, failure of many health insurance plans for them. They cannot afford so many treatments, fear of being mistreated, cannot afford refused treatment in so many places. They are harassed and assaulted in the healthcare centers. A transgender-friendly healthcare professional has to be approachable, empathetic, inclusive, open, and understanding. So, creating an inclusive environment by having a proper knowledge and comfort and caring for them, and training and empowering the front desk staff, nursing staff, billing staff, how to address them, and if there is any mistake, if they feel bad, so don't hesitate to apologize for the mistakes. So creating an inclusive environment, ask for the pronouns, what they prefer, she, he, him, hers. So it is for everything in all the forums, you should make it a rule that you have to ask them, what do they want us to address them. A non-discriminatory policy board has to be put, and one restroom which is gender neutral, and create a system where names used by patients, gender markers, and pronouns are used for every patient every time. So there can be gender incongruence and gender dysphoria even in the childhood. Sometimes it can be recognized right from the childhood and adolescence. So if you recognize it properly and they're really suffering from that, so there are also what is known as puberty blockers. You can block the puberty, delay it till she is the age of she or he is the age of majority, and depending on what they feel, then that line can be developed so that the development of secondary sexual characters can be avoided. So there are so many aspects where how you can diagnose that there is gender dysphoria. A marked incongruence between one's experienced gender and also the primary or secondary sex characteristic. A strong desire to get rid of these primary secondary sex characteristics, a strong desire to be the other gender, and also a strong desire to be treated as the other gender and the typical feelings and behavior of the other gender. So there is a word what is known as coming out. This is the term because many are the LGBT or homosexuals or what transgender, they don't express at all. They not that every person will express or not that every person will come out, and so many times they suffer inside hurt, and so that can lead to various mental aspects and also suicidal thoughts. So this is to describe their experience of discovery, self-acceptance, openness, honesty about LGBT identity, decision to disclose, to share with the others. So there is how they can, if they feel like that, a female born in a male's body or a male born in a female's body, how they want the gender. At some point of time, it becomes so much of a stress from inside for them. So they just think that they have to change their gender. So how the transitioning can happen? This is a process of changing the way someone's gender is lived publicly. So transitioning involves changes in clothing, changes in grooming, name change, change of gender on documents, hormonal treatment, and surgery. Surgery is the last resort, and when they go through all the things and still they feel that they want to change their gender, then only surgery as a last resort that is done. So criteria for transition include psychiatric counseling for 2 years, medical transition, and surgical transition. So transition from one gender to another, again, there are 3 stages. Initially, you should allow that person to be in the other gender. This is a living experiment. That's a real life experience. So living in the desired gender role with the clothes and the talking and the behavior. So they have to live in that role for some time. Then use of cross-sex hormone therapy after living in new gender role for at least 3 months. So 12 months is preferred usually. Then last thing is about gender affirmation surgery after living in the gender role and using hormone therapy for at least 12 months. So how this role of psychiatry and psychotherapist will come. There are social and mental health risks for transgenders. Social risk, as Dr. Balsundar was describing, how much they can have the mental health problem, depression, anxiety, substance use, suicidal attempts, and the similar bullying, parental rejection, ostracism, sexual harassment, physical violence, homelessness, and increased risk of genital infections. So there is standards of care from World Professional Association include, this says, 2 referral letters from qualified mental health professionals is needed. Well-documented persistent gender dysphoria has to be there, and age of majority has to be there. Capacity to make fully informed decisions, control of any concurrent medical or mental health condition, and hormone therapy for 12 months. So this medical transition involves giving the hormones. For example, a female has to be converted to male. So the female, to convert into male, they have to use the masculinizing hormone, testosterone. For conversion of the male to the female, estrogen hormones have to be used to make them a female. So obstetrician gynecologists should also be aware of this transition care. So when you use this masculinizing therapy, a female to male, so that will include the development of facial hair, the deepening of voice, body hair, changes in the sweat and odor patterns, fat distribution, vaginal atrophy, cessation of menses, increased clitoral size. These are all because of the testosterone that they are taking. So this for masculinizing therapy to use testosterone, there are certain contraindication one has to understand. So lipid profiles and general checkup and all the investigations, liver function, lipid profile and kidney functions, everything has to be done for them before starting masculinizing therapy. So this includes testosterone with various preparations, so which are there, and different routes, oral, parenteral or implant, transdermal. So endocrinologists will be taking care of these things about the indication, contraindication, how they have to maintain and what level of testosterone they have to maintain, all that becomes important. So feminizing therapy like male to female, this will, when they give estrogen, so that will cause decrease in erectile function, testicular size, breast growth and body fat changes. And the main risk with the estrogen therapy is about thromboembolism, hypertriglyceridemia, development of gallstones, elevated liver enzyme. So these are all hormone related side effects can happen. So smallest dose to achieve desired effect is recommended. We have to maintain estrogen levels less than 200 nanogram and testosterone in female range less than 55 nanogram. So it is not enough if you use just estrogen, because the adrenals are producing steroids which can get converted into testosterone. So you should also use some anti-androgens to suppress these steroids which are produced from the adrenals, like additional spironolactone, cyproterone acetate, GnRH agonists, and these drugs can have to be used for them. So this is how the feminizing therapy, when they use, the breast size start increasing and changes in the hair pattern and the body fat distribution, and varieties of hormones are available. So cross-sex hormone treatment, prolonged estrogen therapy can all cause changes in their genitals. Testosterone also can cause changes in the body for that. If at all, at any stage they prefer to store the gametes, then they have to stop the treatment for 3 months and then go for fertility preservation. So this is the main important thing as a last resort which has been done, surgical procedures for transgender individuals. It is known by various terms, SRS, which is commonly called sex reassignment surgery, gender reassignment surgery, genital reconstruction surgery, gender affirming surgery, or sex realignment surgery. So it can be feminizing surgery or masculinizing surgery. So they call it in the top surgery or bottom surgery when they restrict to mastectomy, or whether it is the breast surgery or the genital surgery. That is how it is known. It is the surgical procedure by which a transgender person's physical appearance and function of their existing sexual characteristics are allowed to resemble that socially associated with their identified gender. For this is done for gender dysphoria and sometimes for intersex people as a medical procedure. And there are prerequisites. So the person has to spend a period of time, at least 12 months, living and thriving in a gender role of the desired sex, 12 months of continuous endocrine treatment, cross-hormone therapy, psychological assessment, family support, consistent gender identity, psychological stability, and psychological preparation, which is extremely important, and a good outcome has to be expected. Surgical procedures for transgender individuals is for trans women, that is if it is for male to female. So these are all the various procedures. Not all persons will go through all the procedures, but those who can afford. And even in Tamil Nadu, even in the government, they have allowed this transgender, this gender reassignment surgeries. Now that many places, these many surgeries are being conducted, but main problem is about the affordability. So the penectomy, architecture, removal of penis, testes, vaginoplasty, clitoroplasty, labioplasty, creating a neovagina, and the changes in the voice, phonosurgery, thyroid cartilage reduction, breast augmentation, feminizing facial surgery, many cosmetic procedures. So these are all the various stages what they do, but majority of them go through the, if they have to convert into female, so male, that breast implants and then genital surgery are the main things that they usually undergo. The surgical procedures for transgender individuals, if they want to convert to male from a female. So you all know that from a female to male to convert, it includes the mastectomy, chest reconstruction, hysterectomy, bilateral salpingo-oophorectomy, and sometimes a vaginectomy. Not all people will go through that. Metadioplasty, phalloplasty, urethroplasty, scrotoplasty, and penile implants and testicular implants. And to retain the erotic stimulation, the erotic structures in the male and female, that is the clitoris in the female is retained, and the glands in the man is also retained for them to give a proper sexual arousal and happiness. So what happens to the quality of life for these people after these surgeries? So majority, if it is done properly without any complication, they are very happy. Even in our MS Ramaiah hospital, there is a team of people who are doing so many of these surgeries for these transgender individuals. If it is done properly, there can be less of a problem. But like any other surgeries, it can also have so many complications. Or once they are happy about that, their quality of life will increase, will be normal. And there can be erogenous sensitivity at orgasm, masturbation, and intercourse can happen. And sexual satisfaction, they can enjoy better sex. And some studies have shown 98 to 100% FTM have orgasm, 85% for male to female have orgasm. There can be psychological and social consequences if they are not properly prepared, like anxiety, depression, etc. And there are varieties of ethical, cultural, and political considerations with all these surgeries. The legal aspects have to be looked into. The affidavit has to be taken from a court with a witness and a doctor, describing to the patient that this is permanent, that this has to be told to the person when they are undergoing this type of surgery. So social support, family support is the one which usually suffers. Then risks of cross hormone, risks of surgery, there can be infection, bleeding, repairs, pain, dissatisfaction, non-functioning of penis or vagina, urinary problems. They suffer from, majority suffer from urinary problems and surgical problems, pain, and with the implants problem and genital infections, HIV. These are the very common things which they usually suffer from. So there can be morbidity and mortality. and psychiatric care becomes important. We have to prevent suicide and death of this individual. So how do they prefer? If they prefer, they want the fertility, if they want to have children, what are the options that are available? Fertility, pregnancy, contraception, and abortion. All these things are also very varieties of aspects which has to be looked into if I have to discuss with the person who is undergoing sex change operation. So they have to be aware about reproductive operations. Pregnancies are possible after transitioning. Contraceptive counseling becomes important for those who have not undergone the removal of uterus and the gonads. So there is possibility of pregnancy occurring in them. And if they want contraceptive advice, that has to be given. And fertility and parenting desires, some can have, and that has to be addressed properly. For all transgender individuals, fertility options can currently be categorized into 3 different groups. So when you are counseling them, options available before initiation of gender affirming hormone therapy, options available after initiation of hormones, and certain experimental options where you can do it when you are doing the other surgeries for them. So role of fertility specialists is they have to clearly inform patients about their future reproductive options before initiating any medical or surgical treatment. These are all various options which are available. Oocyte, I don't have to tell to the gynecologists, they know all this. Oocyte cryopreservation, tissue preservation, sperm preservation by ejaculated semen, or the TISA or PISA for future ICSI. For trans women, if masturbation is difficult for a trans woman with male partner, donor egg and surrogates can also be used. And there are also, they have done some uterine transplant, which has been there. These are all the various procedures which are available for them in vitro fertilization. Pregnancy in trans men without GRS are able to conceive. So if female to male conversion, if you have not removed the uterus, so they can carry the pregnancy because of the uterus and ovaries. The menses also will return after stoppage of testosterone. Uterine transplant for trans women, less than 42 uterine transplant procedures have been done till now. At least 12 labors have been reported. So there are certain rules after doing the uterine transplant when you have to use for the immune suppression and embryo transfer. So that has to be followed. And what is known as chest feeding. Some of them say they are not gone through the pregnancy, and so there is no breast milk production after the delivery if it is through the surrogate. So some of them may feel like going through this feeding, or they call it chest feeding because they don't want to use the breastfeeding. So there is one method, what is known as Newman-Goldfarb method. So where you can induce lactation without going through pregnancy, using combined oral contraceptive pills and domperidone, which can have an effect on breast like galactorian. And for the baby suckling or the breast pump, continued suckling and with the breast pump, the stimulation for milk flow, it has happened in many transgenders. So there has been a report of transgender women successfully inducing lactation and continuing breastfeeding at 6 months follow-up. So these are all the possibilities which one has to be aware. So gynecologists should not be scared. They are scared to handle and they are not sensitized. Think other patients may not like to mix with them. This is the major thing. If those people come and stand and sit with other people, I may lose other patients. So that is another concern which many doctors have. So where the role of gynecologist will come when there is a female to male conversion. So the hysterectomy, salpingo-oophorectomy, vaginectomy, mastectomy. So the role can come. Again, male to female. The gynec role comes after sex reassignment surgery. So there are preventive health like screening and screening modalities. If there is a bleeding, spotting after the cross hormone therapy, if the uterus is not removed, cancer screening, breast screening, infection, sexually transmitted infection, they are very much prone for these genital infections. And we may have to use a small speculum for that, a comfortable position, and they're undressed partially. So cancer screening, the general rule is that any anatomical structure present that warrants screening should be screened regardless of gender identity. So there is insufficient data to determine whether transgender individuals are at increased risk of malignancy compared with the general population. So for the trans masculine individuals, breast cancer screening for patients who have got breast tissue and cervical cancer screening for those who have cervix is very important. Routine screening for endometrial cancer is not recommended for trans masculine individuals to still have a uterus. So a neovagina does not require routine cytologic screening. If a vaginoplasty has been done for the conversion of man to woman, so that does not require any cytologic screening. But because the prostate, if it is not removed, then prostate cancer screening for the trans feminine individuals also becomes important, like the general population. So in the sexual functioning of these people, so there are varieties of sexual activities for them. And so all the things which are concerned with the sexual well-being, whether it is sexual function, sexual pleasure, satisfaction, or quality of sex life, and either their sexual activities which they adopt, so sexual relations, all that thing is there. So if a proper reassignment is done, because of the lack of money and they cannot go to proper healthcare facilities, so they were getting the operations done in where there are not good facilities with lot of infection in crude method. So those people suffer also from varieties of sexual dysfunction. They can have, like other persons, like any person, they can have all possible sexual dysfunctions and satisfaction problems, quality of life. So all the things become important when you're considering sexual functioning of these individuals. So there can be sexual activities with the man to man and woman to woman, and varieties of sexual activities, that mutual hugging, kissing, masturbation, anal sex, oral sex, and varieties of sexual activities which are there for them. So there are the additional considerations which you have to know is about the routine preventive health care, and they should be screened for intimate partner violence. They are very much prone for this, depression, substance use, STDs, and counseling about appropriate immunizations based on age and risk factors, especially the HPV vaccination, family counseling, because for many transgender family will not accept them, and they come out of their houses and they do not have proper job or the money, and family support is not there, and family cannot accept them. So it needs a lot of family counseling. So the pap smears, bimanual examination if vagina is not removed, fertility counseling, if there is bleeding, spotting, the gynecologist may have to see, the cancer screening, and routine gynec care, and sexual health and sexual dysfunction if they come to, and acute and chronic conditions, bleeding, pelvic pain, pelvic floor disorders, hysterectomy, and sexually transmitted infections. So in summary, creating a welcoming environment for them is extremely important. For that, first we should be aware of what it is and how we have to take them as an inclusive environment, create an inclusive environment. So every person has got a right for health, and it is our duty to give health irrespective of whoever it is, a human being. Inclusive environment in society, adding transgender options in all application forums. Language should be inclusive, treated with dignity and respect, confidentiality maintained, non-discriminatory policy, training staff to increase their knowledge and sensitivity towards transgenders. So we have to build a world free of shame, secrecy, and unwanted genital surgeries. So I again request you all to participate in the mega free health camp for LGBTQA on 5th July 2023, 9 a.m. to 2 p.m. at Wilson Garden BBMP maternity home premises. Our Honorable Health Minister will be inaugurating, and all the BBMP, BSOG, KSOGA, family planning, they all will be participating. So I request you all for that. And that's why this is a prelude to that, the sensitizing the doctors and the healthcare providers about this LGBTQ. Thank you very much. So whatever it is, this is the rainbow, which is their flag. So I am gay, I am lesbian, I am bisexual, I am transgender, I am a pedophile, but I am human being above all. So whatever any human deserves and desires, so that has to be given to the person irrespective of gender identity or gender expression or the marriage, sex, and what age, ethnicity, whatever it is. So we as healthcare providers, we have got a duty, responsibility to take care health of all persons in the society and without any discrimination. Thank you very much for the patient hearing.
Thank you very much, madam. I now request Dr. Venkatramana to give his valuable comments.
At the outset, I will congratulate Dr. Padmini.
Thank you, Dr.
For giving a nice talk, a eye-opening for all healthcare providers. Today, though it is there since ancient times, now the time has ripened. All sexual minorities want their rights to be implemented. Even our Indian Constitution speaks about it, that we are all equal before law, but that equality should be established in all aspects, political, educational, employment-wise, health-wise, for these sexual minorities. Since our talk is now restricted only to healthcare providers, we should develop an attitude of unbiased attitude, accepting there as it is. That is very much needed. Our own values should not interfere in taking the patient, in treating the patient. So that attitude we should develop so that we can do justice for them and they will become a part of mind track, and I am assured that they will participate in the development of the society, development of the nation also. Lot of educated people are there in the sexual minorities, qualified people are there. Some people, because of running away from the families or discarded by the families, they are away from the education. Some are, yes, socially at low level. But all these people, if we healthcare providers able to take them as it is, as a human being, we are going to do humane service for these needy people. I once again congratulate for taking lead by Karnataka people, particularly headed by Dr. Padmini Prasad, for taking a mega camp. That's a very good thing. And she is a part of our family of CSCPI. So whatever she is doing there, partly that comes to us, to our family of CSCPI also. That credit comes to us. So indirectly, we are also proud of her. Thank you, madam. Once again, all the best for your mega camp.
Thank you very much.
Thank you, Padmini. That was really a very exhaustive talk on the gender sensitization. You really brought out good points in them, and really you created an awareness among the doctors. I think many should have logged in. Really, it is an eye opener. As Sir said, it's really an eye opener for all the healthcare workers. As he said, we really need to look into this matter, and I think you are doing a first time a mega camp on this, and I wish you all the best for this, and I think we'll be part of this mega camp.
I request you all. Thank you.
Thank you, madam.
Thank you
Dr. Nirmala Buggi had joined, madam.
Yeah, please let her address the...
Nirmala madam? No, I think she's not there.
Shobha.
Had joined in between. She had joined in between.
Shobha is there.
Shobha, you can unmute Shobha.
Ma'am, thank you for the elaborate talk, and it was like for us is the first time listening so many things about the transgender thing, and we are looking for the camp, ma'am. Thank you so much.
Thanks for all that. So I think they are busy where Dr. Nirmala Buggi and Dr. Trilok Chandra, they are busy in a meeting, I think. So probably they couldn't join. Okay, thank you very much, Shobha, and all the BBMP staff who helped us for this. Thank you very much.
So before we conclude, I would like to propose the vote of thanks. I would like to thank Dr. Padmini Prasad Madam for giving us this wonderful lecture on transgender. I would like to thank all the chairpersons, Dr. Nagaratnamma and Dr. Venkatramana sir, and our guests of honor, Dr. Shubha Ram Rao, Dr. Nirmala Buggi, Dr. Kalpana Apte, and also Dr. Hiremet sir. Also, Dr. Balasundar, who had joined in the last, and he gave his words of wisdom. I would like to thank BSOG, KSOGA, BBMP, and the Family Planning Association of India for encouraging such webinar. I would also like to thank MQ Pharma, Mr. Bhatt, for helping to organize this webinar. Thank you very much.
Thank you, Dr. Sunita.
Thank you
for moderating this session.
Thank you, ma'am.
I thank all the delegates who have joined and have been a part of this whole webinar.
Thank you, Padmini, for
Thank
that
you, Padmini, madam.
opportunity.
Thank you, sir.
Thank you.
Thank you.
Yeah. Thank you, Shubha. Thank you, Shivnarayan. Thank you, Nagaratnama.